So the next scenario that we're going to talk through is a partial blockage, which is probably one of the most challenging ones to deal with. As we have discussed in the previous scenarios, we would go through our safety, stimulate, shout for help and oxygen before moving on to assessing the patency of the tracheostomy. So if you would like to now try and give Dave a suction, and we will see if our tracheostomy is patent.
So I'm using a size 10 suction catheter, as Dave has a 5.5 tracheostomy, and I'm going to try attempt to suction to 8 centimetres. So it does go in, but there is some resistance.
So this looks like we might be dealing with a partial blockage, but at this point it's really important that we look at our patient, as that will determine what we do next. If our patient is compromised, as they are in this scenario, and they're desaturating and working hard, we would need to move fairly quickly to an emergency change. There might be other signs that tell us that that is the right thing to do. For example, at the moment Dave has got an unexpected leak around his tracheostomy. That might also hint that he's got partially blocked trache, as the air is being forced out around the outside of the tracheostomy. If he wasn't compromised, we could look at other options, for example giving him a nebulizer and then trying again to suction, or using a smaller size suction catheter. It's a really tricky scenario, so you always have to use your clinical judgment, but the key thing is to look at your patient. But Dave is compromised, so we're going to move straight on to an emergency trache change. Is there anything different we would need to do in this scenario compared to things we've done in previous scenarios with regards to an emergency trache change?
In this scenario, Dave has a cuffed tracheostomy, so we would need to remember to deflate the cuff before removing the partially blocked tracheostomy.
Great, I'm going to do that now so that we can move on to the tube change. Sam, please would you remove the old tapes, and I will get ready to insert the new tracheostomy of the same size. Sam, please would you re-inflate the tracheostomy cuff now?
So I'm putting in 4 ml of water.
So now we have a new tracheostomy reinserted. What would we like to do next for our patient?
Now we will reassess Dave and to determine whether or not he is breathing again. If he has stopped breathing, then we would commence CPR by giving 5 rescue breaths. If he has started breathing again, we would administer oxygen and continue to stabilise.
That's great.